Hi, I'm going to take you through a procedure that I've just performed earlier on today in my clinic here in Edgbaston, and it is a shave excision of a mole. It's a mole on the top lip, and you'll see from my previous videos what sort of lesions are suitable for shave excision, and that's broadly speaking benign lesions, lesions that we don't think are cancerous, and lesions that are raised. And these sorts of lesions can be treated effectively with a shave excision that can be done relatively simply here in the clinic on a walk-in, walk-out basis. We can actually do it on the same day as a consultation. We offer see and treat clinics here, as we have a minor operating suite which is fully equipped and on-site. So what the procedure involves is, first of all, we take you up to the minor operating suite, and I mark the outline of the mole with a pen. And the reason I do this is because when I inject the local anaesthetic, everything gets quite swollen, and the borders and the outline of the mole can be a little bit difficult to see. And by marking it with a pen before putting the local anaesthetic in, that can help me to delineate where the mole is and exactly the area that I need to shave. Also, the local anaesthetic can blanch the tissues because it's got adrenaline in it. Adrenaline clumps down the blood vessels and makes everything look white. And so if it is a slightly not very colourful mole, if it hasn't got much pigment in it, it can make it blend in with the surrounding tissues. So it's quite important to put some little dots around the outside before you start. Once your local anaesthetic's in, I'll test it's working before I start, and then it involves taking a very sharp scalpel and moving the scalpel along parallel flush with the skin to take that mole off level with the skin and take it off flush. I then check that the surface is smooth, that I haven't left any little ridges or any edges around the sides, and then we use a device called a diathermy, which is passes electrical current between a pair of forceps, and that stops any little blood vessels, and that's these blue forceps you can see here, which are just stopping the blood vessels to make sure that there isn't any bleeding afterwards. Sometimes you get a little bit of bleeding when the adrenaline wears off, but it's normally held within the dressing, so it just makes the dressing maybe turn a little bit red. So you can see the dressing that I put on here is what's called caltostat, which is a dressing which will encourage the blood to clot, so it doesn't mean that it means that you don't get a significant amount of bleeding. And on top of the caltostat I put little things called steri-strips, sometimes people call them butterfly stitches, just to hold the caltostat on. That caltostat and steri-strip dressing stays on for a few days, and we give you a little tube of ointment to put on once that dressing falls off, and it will leave a little scabbed area that then will heal up and leave a red mark, which gradually fades. It can take some months to fade, but it is usually quite hard to see where the original lesion was. So I hope that that's been helpful, showing you that case that we've just done this morning. And if you have any questions, by all means please get in touch, because it'd be great to hear from you, or you can comment on this video. So hope to see you soon. Thank you.